Upper respiratory tract infections are almost always viral infections. So antibiotics don't work. They're of no relevance whatsoever. They're just not effective. In fact, even in the small minority of upper respiratory tract infections that are bacterial infections, they're self-limiting. Antibiotics are still not necessary. People don't need antibiotics. They really don't want antibiotics. What they want is a solution to their problem, which is generally maybe a sore throat, maybe nasal congestion. So symptomatic treatments are the things to recommend those patients with upper respiratory tract infections. We recognise in Australia that antimicrobial resistance is an enormous problem, potentially a catastrophic problem. And over a number of years now, we've been conducting campaigns aimed at healthcare professionals, doctors, pharmacists, dentists, nurses, and also to consumers, the general public, to ensure there's a greater awareness of the need to restrict the use of antibiotics, to use them only when absolutely necessary, so that antibiotics will be useful beyond the next 30, 40, 50 years to prevent what could be a catastrophic threat to our healthcare. Clearly, antimicrobial resistance is an enormous problem, potentially getting greater and greater, and it can only be solved, if you like, by concerted collaborative effort. But pharmacists have a real role to play here, not only just in ensuring our customers know about the issue, but being more proactive, ensuring people know that antibiotics are not the answer to all infections, that things like vaccination, sanitation, and symptomatic treatments are what we should be using first. So say pharmacists can do that. They're the lead, they're the primary healthcare givers really, they're the people who are most accessible and can provide that first-hand advice to people on the most appropriate use of antibiotics and when not to use them, when to use the symptomatic treatments as well.